Today we will explore the connection between addiction and mental health. While this is a topic that often covers a wide variety of issues and information, we will be focusing on introductory information and a preliminary overview to this area. When exploring this topic, the most common concept that emerges is referred to as co-occurring disorders. The basic definition of a co-occurring disorder is someone who is diagnosed with both a substance use disorder and a mental health condition such as depression. In the past, the term dual diagnosis or dual disorders was commonly used, but currently, the term co-occurring disorders is preferred. This is because dual implied only two, and in the case of co-occurring disorders, more than two issues can be common. For example, a person with an alcohol use disorder can be diagnosed with both a depressive and anxiety disorder. With co-occurring disorders, some of the most common types of mental health issues that emerge are depression, bipolar disorder, schizophrenia, anxiety, and post-traumatic stress disorder. While other mental issues can be present, these are the types that are most commonly discussed. In addition to common types, it is important to note that there can be a wide variance in how both disorders impact the person. Some people may experience mild forms of both, while others may have a mild form of one and a more severe form of the other, and still others might have a more severe form of both. These differences are important to consider as they can result in further variation in terms of how someone's quality of life and functioning are impaired by the conditions. When discussing co-occurring disorders, a common question emerges: what is the cause? For decades, an attempt to understand what causes co-occurring disorders has been studied. Often people wonder questions such as, does one come first with the other one later? Do they emerge at the same time? Is it a condition that is inherited? While these are all understandable questions, the reality is that the cause or causes of co-occurring disorders is a complex process. The causes most frequently explored have been biological, meaning is there a potential impairment in one's chemical makeup or disruption in optimal brain functioning that increases the chances of co-occurring disorders to occur? Another cause is genetic, meaning is this a condition that is inherited from one's family history based on genes? Is there a type of quote-unquote predisposition to co-occurring disorders? Still another is environment. Do environmental conditions, such as the conditions of where and how one grew up, or current environmental factors make one more vulnerable to developing co-occurring disorders? The most common perspective with these potential causes is that each play a role in someone developing co-occurring disorders. Most in the treatment community do not view it as a single factor or cause, but a combination. To further complicate this area, more and more information and sub-factors continue to surface. For example, what role does trauma play in increasing one's vulnerability to biological, genetic, and environmental causes? Or factors such as life stressors or poverty, how do they contribute to the development of co-occurring disorders? Because of these related issues and questions, it is very important not to distort the role of one cause over another, as there are still questions and areas to explore, as well as answers lacking complete certainty. For example, when discussing genetic factors, too often this gets oversimplified into trying to identify one gene that is the cause, when in reality, assessing genetic factors is an in-depth process that involves looking at multiple genes along with genetic patterns and linking. It is important not to reduce a very complex question of cause into an oversimplified answer. So, when looking at co-occurring disorders in this field, it is necessary to proceed with caution when discussing causes. Another area to discuss in the introduction to co-occurring disorders is treatment. In reality, whatever the actual cause, it is critical to provide those dealing with co-occurring disorders supportive and effective treatment. And this is possible to do. In the past, co-occurring disorders were often treated separately or with different treatment providers, meaning clients had to discuss one issue with one provider and the other with another, often at different agencies. Still, many believed that you had to quote-unquote cure one and then move to the other. These treatment approaches have been replaced with a newer model called integrated treatment. This is an approach that treats the substance use disorders and mental health issues at the same time with the same provider or treatment team. It also takes a holistic approach focusing on including factors such as culture, individual support needs, and use of outreach or community services. This allows for a more comprehensive and culturally relevant approach to co-occurring disorders, which has shown a higher success rate. When talking about co-occurring disorders, it is critical to hear from clients about their experiences. Unfortunately, those dealing with co-occurring disorders often deal with increased stigma and recount their difficulties going through treatment when the approach was focused on separating the conditions. In the video below, you will have a chance to hear personal experiences of those managing co-occurring disorders.